Hi again, everybody. This is actually an updated recording for Lecture 2. I updated the injury stats I tried to get them as recent as possible. So the only thing I forgot to do was change that year. We're going to look at it from an overall U.S. Fatality, and then we'll look at the Bureau of Labor Statistics, and we'll also look at some costs associated with it, so estimates through Liberty Mutual for work comp treatment. And then we'll get into some of the topics you will be reading more in depth and reporting on the first 3 chapters in the Oakley textbook. Okay, and there's some other things there too. So from Lecture 1, some of the things I want to review with you very, very quickly is what I found interesting is the functions of a safety professional based on the ANSI standard that was discussed. That the focus of the first 5 or 6 lectures is the anticipate, identify, evaluate hazardous conditions and practices. Modules 2 through 4 will be develop hazard control design, methods, procedures, and programs. And then in other courses, you'll get the other 2 elements. But also, based on things we cover in Lecture 5, you'll see that this is just one particular subset of elements of a successful safety program. Went over the OSH Act, and in particular, Section 5, which when it's cited in a citation for a violation, it's 5A1. Each employer shall furnish to each of his employees employment and place of employment free from recognized hazards that are causing or likely to cause death or serious physical harm. Make sure you understand that. It's the primary protocol for the safety profession. So now we're going to go into, and I want you to make note of some. Now, it's interesting that even with some more recent increase in fatalities and certain classifications, and we'll talk about those, that the top 3 tend to stay the same and also the most expensive. So I was able to acquire the 2022 10 leading causes of death in the United States by age. And the reason I wanted to show you this is that number 1 for all is heart disease, 704,000. But the 65 and older population accounts for a huge portion of that. And then if you go to 55 to 64, another big portion. Between the two, it's 670 something thousand. So these 2 age groups account for a majority of these. Whereas, heart disease is down here, excuse me. So it'd be adding this onto here and then that onto there. But it is still a majority. Though the 45 to 50, their number 1 cause is malignant neoplasms, which is cancer. It's a scientific term medical term for cancer. But the 2, I don't want to say largest, but the 2 highest age groups, I mean, the likelihood of death is more common. The risk is much higher. It's going to happen. And so should we be counting at least the 65 and plus in the overall? Because when we get to, let's go to working ages, 15 to 24, 25 to 34, 35 to 44, the number 1 cause is unintentional injury. Number 2, we've got 2 suicides, a homicide. If we go to top 3, heart disease kind of starts getting here. So does cancer. Cancer is also with the 10 to 14-year-olds. Homicides here. Suicides here. Heart disease. So you get into the top 5 and you're having some similar things. But what's interesting is the number 1, unintentional injury, because that kind of relates to what safety and health, occupational safety and health practice is all about, is preventing serious harm, death in the workplace. And it's unintentional injuries that occur there. But it is interesting that these have come up as well. All right, so let's go to the Bureau of Labor Statistics. This is their fatality data, and this is older. And I wanted you to kind of compare what it was. I didn't want to do it for the overall. But you can see here, transportation accidents, number 1 by far. You see the difference here? It's more than twice the second highest, which may either be violence or slip, trips, and falls. Contact with seems to come in here too, top 5. But then fires and explosions, very low frequency, very low cause of death. Fires and explosions, though, when they occur, they hit the news first. These other ones, not as much. Maybe a fall. Rust not as much. Well, violence would too. But that was in 2018. Let's fast forward to the most recent set of data, which is for 2020. Transportation is still, as you can see, twice as much as falls. Violence is here. See, it hasn't changed a lot. I think exposure to harmful substances may have gone up. Yeah, it was a little bit lower. It's higher. Fire explosion still a small amount. Some of the key findings are up here. He says that homicides have increased, that overdoses have increased, transportation, moving has gone up, and yeah. But what's interesting is, let me give you some insight here and see if you agree with me, is that things have become irregular since 2020 due to the pandemic, and people weren't sure how to report when people either became debilitated or died from the coronavirus, or the increase. We have had a significant increase every year of fentanyl overdoses, and finally there has been an increase in violence, gun-related violence, and I believe up here homicides accounted for 61.7% of these fatalities. Yeah, and suicides in certain industries are also increasing. So this is non-fatal. So these are injury and illnesses that occur. They either go to the hospital and get treated, maybe stay home and recover, or maybe they just go back to work or come back to work in a limited capacity. This is the 2014 to 2018. Now, unfortunately, they don't really provide this type of... That's the thing. BLS, they changed the way they did things. So it's really hard to compare, later, years with current years. But this is what they do have. Now, we still have the overexertion, contact with, slip, trips, falls, exposure, violence. You see how it kind of jumps down a little bit. Transportation is in the top 6, but you see it's way down here. Overexertion, bodily reaction wasn't even in the fatality. Slip, trips, and falls, exposure to harmful substances, contact. Violence is a lot lower. Again, in comparison, because these happen a lot more. It's not a great comparison, not apples to apples. Here it talks about, because we have both, these are just the lost time cases too. These aren't the non-lost. So this is a little bit of a skewed, but gives us insight. And then, again, if you look at the illnesses, it spiked. It came down in 2021, up again in 2022. Not sure why. We've got the reported cases. This is 19 to 22, so it's kind of a good thing to look at. Things went down in 2020. That was the year everything kind of closed down. That injuries have been steadily increasing. Again, illnesses were high in 2020 and then dropped and then made a recovery. So interesting. So 2019, before the pandemic, you see how few illnesses there were, and now since 2020, they're considerable. But the number of injuries has increased. Now, that's not a perfect way to do it, because the number of people working may have also increased. So you really should look at rates. But all I really want you to do is get sort of familiar. There is no updated table here for the nature of injury. They really changed how they analyze and report things, but you can kind of see strains is number 1, soreness is 2, and then the third tier is really the cuts, bruises, fractures. Not great information by any means. Every year, Liberty Mutual publishes their what is it called? The Safety Index, and I was actually able to find 2023. It took a little bit of time. What's interesting is the top 5, 1, 2, 3, 4, 5, account for about just under 63%. So just under 2/3. You take the whole top 10, it's about 82.2%. And that actually changes year to year, which is really odd. That should be more of a consistent representation. So weird. But the pandemic may have still be affecting that. So let's look at some of the numbers. Overexertion, falls to same level, falls to lower level, struck by object. Other exertions. So we've got ergonomics here, 2 in the top 5, falls 2 in the top 5, struck by 1 of the top 5. We expand to the top 10. We've got exposure to harmful substances. COVID is there. So I think that one has, kind of increased because of that. Vehicular crashes here. We've got caught in, slip, trip, and fall. So we got 3 categories for slip, trip, and fall. And then we've got vehicular down here. And again, that is a portion. Did you know workplace injuries cost U.S. businesses more than $1 billion per week? That's more than $58 billion per year, with the vast majority caused by just the top 10 causes. Yeah, because we see it's 82%. But there's a little bit of language over here. And I provided a link so you can take a look at the Liberty Mutual, you can take a look at the BLS, you can take a look at the CDC. It's all there, so you can take a look. Now, when I talked about hours worked, I want to give an example here. So on the left, we've got the 2022 number of non-fatal workplace injuries and illnesses just for private industry, which I think is well over 90% of where the workforce is. You can see here that if we looked on here, healthcare and social assistance as an industry has the greatest number. Okay, number 2 would be retail, trade, 3 manufacturing. But if we go over here to the rate, the number of cases per 100 full-time workers, number 1 is transportation and warehousing because they have fewer workers. Agricultural fishing is number 3. Number 2 is healthcare. So they had the biggest number, but they're number 2 on rate. I would say number 3 is probably arts and recreation. 4 would be agricultural, hunting, and fishing. So again, it's the number of workers, or the estimated number of workers in each of these industries affects the rate. We tend to use the rate as a measure. I think in Lecture 7, we'll be covering this more in depth. Another issue, and this is somewhat new, is that if you're going to collect data and say this is the average based on this criteria, the first thing you need to do is establish that your data set meets the minimum assumption of normality. If you don't, there are some things you can do, but the thing is, and I'm going to show you here in a moment, I'm doing some research with a grad student right now. This is what the injury data looks like from a severity perspective. This is a distribution on frequency and severity. There are a lot more non-severe injury and illness cases versus the very severe, very few deaths. The ratio is like 1 to 1,000, 1 death per 1,000 injuries. And so it's more asymptotic. So the average would be somewhere here. The median would be somewhere here. Is that right? Yeah, the median, yeah. So what do we really take into account? And that's where things have been getting kind of confusing. And why don't I take a moment, see if I can pause this, and I'll bring up to you an example of what I'm doing. So we downloaded, basically, is this 8 years? 8 years of data from OSHA. Again, we'll talk about this in Lecture 7, but OSHA requires companies to upload their 300A data, which is the classification of if it's recordable, was it lost time, was it restricted duty, or was it other recordable, and it met those criteria. And so the total number of entries is here. So it's been going up each year, the number of companies who are actually participating. They're supposed to do it. The number of employees has gone up. The work hours has gone up. But nobody's really looked at it. I compared what they had for hours to the BLS and found that the data we have here, look at right here, 5,700 times more. Why? Because the max hours reported was right here. This number right here, this company that put in that their workers put in this many hours, it breaks down to 2.4 trillion hours, each worker, each person. How busy would you be if you had to put in, there's not even 2.4 trillion hours in a year. Not even in a lifetime. And so some people have been screwing up when they upload. And when they do, it messes up the data really bad. So what we've done is we've gone through, we have both counts and we've got rates. And you can calculate the rates by taking the number of cases multiplied by 200,000, which is a constant, divided by hours worked. And you can take it at totality. But what I was able to do with the data is to calculate those same rates for each individual company and then average and median those, which is a better way to do it. It's a more honest way to do it. But it really shows that we have an asymptotic data set. So after we did all of our cleansing, we found out some stuff. We looked at the percentages of things over time. This should be somewhat consistent from year to year. But what's interesting is that fatalities are not consistent at all. These percentages, it's interesting how they changed a little bit. And the percent hours, how they had changed. Again, this is a corrected data set. How much of the data did we remove? Is that in here? Is there a percent? That's 0 injuries. I'm not sure here exactly where it is. But I did some corollary and some covariance calculations in Excel. I also ran normality tests using SPSS, which is a statistical package. And so here's really a summary, is that things don't match up to the Bureau of Labor Statistics. They don't match up internally either. They do sometimes, but it's not great. And so what we're going to do is we're going to write a series of papers based on this. I also have another, which this needs to be corrected. This is what we put together right away. You can see the trends of things. And what this is each version of how we adjusted it. So if the Bureau of Labor Statistics is purple, it's right here in the middle, looks like it's going down. Our fully corrected is light blue. It looks like it's going up. Same with here, though their dart looks like it's going up slightly. May have to correct that. The median is here. It looks like the median is going down. That would be green. Yep. The individual entry calculations were very different than the overall. So we're going to be creating graphs and really studying what are we really comparing our numbers to. So that's something that I'm doing with a grad student right now. Oh geez, we just went dark. What did I do? Pause. Wow. Okay. I just had to reboot everything. That was kind of crazy. Okay. So now on to the second part of this lecture, which is the getting into the textbook, the Oakley textbook. And on the screen, I've got a lot of words. I probably should bring in pictures because you're going to be reading this anyway. But I do want you to pay attention to how he defines what is an accident versus versus an incident versus a near miss, because it is very important. The reason that this stuff is so important, and then when we start getting into the understanding the sequence that leads to it, or the model that leads to it. I hope I didn't mess this up too much. That OSHA has a criteria that when something happens, somebody incurs harm, get them with the treatment they need, and then based on certain classifications, whether it gets recorded. There's also conditions which it's so severe that it gets reported. We actually have to call or contact OSHA and let them know that it happened. And it tends to result in a compliance officer coming to your business to see if you had violated any standards, safety standards that resulted in the injury, the severe injury. But what's interesting, and something that I had done, and I'll be sharing this probably in the review, that in my position at, as the EHS manager, I sought to collect the less severe. And there's two reasons for that. One is I do believe that the exposure to something that could cause harm, why do we wait until it actually causes harm to investigate it? That if workers recognize that, wow, I almost got hurt, or, that could have been a lot worse, I still want to record it and investigate it, because maybe we can come up with a solution to mitigate that exposure in the future, and then it never happens. It doesn't happen again, I should say, or it doesn't result in the higher level of severity. The other is I was creating an environment, or a culture, if you will, in which workers weren't afraid to bring me their concerns, their ideas, their observations. And I encouraged that, I rewarded that, I acknowledged it, and I let that input from the workers, that engagement, drive my priority list of what I needed to investigate and correct. And in doing so, I was able to reduce the 2 previous years' amounts paid for work comp injuries and the frequency rate of both severe and non-severe injuries. And I got a lot fixed, and the workers seemed a little bit happier, and I took a very different spin to it. But you got to learn to stand before you walk and walk before you run, and so it's still good for you to be exposed to this material here when it gets into definitions and everything. One thing that I have lived by is that Oakley had stated on page 6, the only difference in a near miss and an accident is a matter of inches, seconds, and luck or chance. I totally agree with that. That when I do my investigations, whether it's a near miss, just a concern, or they had to go to the hospital and get treated and they can't come back to work, I approach it the same way to try to identify the root causes. What were the series of events? I never blame the worker. They may have contributed, but blaming a worker who is just trying to get a job or a task done and they happen to get hurt, I think that's adding insult to injury when you blame them or go up to them and say, well, what, I'm going to punish you for getting hurt. Have you ever been blamed for something that you didn't intend to happen? You're just trying to get something else done and then there was a negative outcome. How do you feel when you get blamed? Yeah, exactly. And so if workers become sort of less committed, sort of detached from the work, resentment towards management, that's a bad work environment. That's stressful to them. It's going to be stressful for management. And they share their story with coworkers, and their coworkers then adopt those negative behaviors too. So when I go into a place and I either observe, this hostility between management and workers, or a high turnover rate, absenteeism, that tends to be the result of not treating an actual accident as just a mishap, and then you're going to try to fix it versus trying to blame the person and punish the person. What I just talked about kind of covers everything. This is kind of interesting. Risk is equal to probability times severity. We will talk about a peer risk assessment later, but what it's doing is you're trying to assign certain numbers, and then when those numbers are multiplied together, the higher the number, the higher the product, the higher the priority. And so I usually call it a risk priority number instead of just risk, but that's the way I do it. And then when you've instituted a control strategy, put it in place, you redo your risk assessment and you want to see if that number went down. At least get down below its original higher priority. Over on the right, we've got the hierarchy of controls. Now this is, we'll focus on this in this class. I want you to use this when you get out and start practicing, not so much. But number one you want to do is elimination. If you can eliminate the exposure or eliminate the hazard, eliminate the risk, people won't get hurt. But that's a lot of work. Takes a lot of sophistication, planning, and engineering, and tends to be expensive. Next is substitution. That really only holds true for certain aspects. Let me give you an example. So typically you use a ladder to climb up and say change a light bulb. Could you use, something that allows you to, like in my garage, I've got a really high ceiling. I've got this pole that allows me to remove the light bulbs and put a new one in. I'm not even leaving the ground. So therefore, the fall exposure has been removed, or substituted, I should say, because I could hurt my shoulder doing that stuff. You could use a better lift, too. If you need two hands to do a job at height, you should be using a scissor lift or JLG, something like that. Or a mobile scaffolding. But when you use a ladder, it's difficult to do two hands of work on that. Usually use a ladder to access something, but you got to be careful. You got to keep 3 points of contact. Engineering controls is typically where we start talking about what we can do to guard, design, make it so people don't accidentally get exposed to something. Administrative controls, we're relying on the worker to make the right decision. We're just trying to, educate them, train them, reinforce them so they're making that right decision. PPE is the final line of defense. It's the least effective and it's the cheapest. So I'm going to sneeze, I think. I hate when that happens. Excuse me. So what's the goals of the accident investigation? It's really to try to determine, to get past sort of the facade of, it's really easy to blame the worker. We naturally do it. But to try to find out, what were they intending to do? How did that intention Where did it come from? How did it lead to an exposure when nobody wanted anybody to get hurt? Okay. Oh, what happened? Okay. Oh, geez. Oh, no. Oh, thank goodness. I didn't know that it could do that. Post-accident response. So when somebody actually does incur an injury, you have to go through a series of records and an investigation. And OSHA has it all laid out under the record-keeping standard, which is 29 CFR 1904. And we'll go more in depth again in Lecture 7. But you should investigate some way, shape, or how. I didn't say that right. It's a fact-finding exercise. You want to document so you can review and try to determine what can we do to prevent this from happening again. And that's a better way to think of what can we learn. Always be trying to learn, always trying to improve or do better versus what can we do to punish that person? Because obviously we told them how to do it correctly. They got hurt anyway. We should punish them. That's a really bad way to manage employees. It really is. And it's putting supervisors in a bad place. So one thing I did in my part-time position was it was continual education to both upper, middle, and supervisory management people, and engineers, and maintenance, and operations. Anybody who would listen, I would give them my spiel. Here's some of the accident models that Oakley provides. I think they're interesting. Not any one is perfect. They all provide a means to understand things. I'm going to show you mine. Mine is a systems approach, but I do want you to know sort of, again, I don't want you to memorize stuff, but I want you to have a general understanding of the difference of these and where they may be effective. Okay. Yeah. So here's it's based on the balance theory of job design, which was a paper published in 1989 by two people who were my most influential advisors and mentors in graduate school. The idea being that a person perceives what is acceptable to do and what they need, what their expectation at work is, and then they perform it. But these other four areas here are constantly affecting how the person thinks, what they can do. A person's focus is get the job done. When these other things become imbalanced, it puts the person in a position where they could choose a shortcut or to expose themselves to hazards or something like that. They will tend to do it because these other areas affected them. So I do like this systems perspective. It's how I do practice. Okay. But what I did is, for teaching purposes and for consulting, I flipped it around so that you can look at something more on like a chronological scale. That these four areas here, which I do continually assess to find out what their influence is on the perception of what needs to get done, and then ultimately the behavior, the choices they make. Now, if there's no exposure, there's no injury. And so that's what we're trying to do, is mitigate, study, control, manage these things so they have a perception of what needs to be done and no exposure. No exposure, no injury. But there could be an exposure but no injury. Here's the thing. I want that stuff reported. I need that stuff reported so I can better understand what led to it. We got lucky, and I want to take advantage of that. But you have to have, this person has to feel like you're caring for them, that they trust you, they're willing to come and share that stuff without any type of judgment or persecution. Then there is the exposure and injury. And the thing is, the way OSHA sets it up, they only collect a certain percent of these. And it's not even that high of a percent. So they are getting very few instances for which an analysis would be done. And you're also, when you're missing out on all things, again, the inches and seconds that Oakley had talked about, if you're ignoring all those things, you're really limited your view of what's affecting the worker. What could be leading to their need to expose themselves to risks or hazards. Oh, good. So this went a little bit longer than I had wanted, but I got to share more insights. So a review. Why should you care about accidents and injuries? Hopefully, you're going beyond the moral. Well, we don't want to kill people. We don't want to hurt people. But really, what it comes down to is these people are doing a job. If they get hurt, they can't do that job, and now they're not going to feel real great about the employer if they weren't treated well post injury. And they probably have responsibilities at home too. So why should we care? Because I care for people, and I care that the business does well. So I try and prevent these things from happening. But I realize that I'm not omnipowerful. I can't prevent all people or control people's perceptions or actions or behaviors. Therefore, I do the best I can to try to balance it. You're going to hear me say that throughout the semester. What are the major causes of death? In the U.S., if you're older, it's health related. If you're younger, it's unintentional accidents in the workplace. The causes of death, primarily, the biggest one is transportation. And that kind of lines up with what we saw against the overall U.S. And then when it comes to workplace fatalities, that's what I meant. It's car, it's falls, it's contact with, it's violence, exposure to harmful environments, which includes illnesses. Very low number was the fires and explosions. When it came to the non-fatal injuries and illnesses, it was musculoskeletal, so it's ergonomic related, so strain, stress, lifting, things like that. Slip, trips, and falls then jumped in there. Contact with, struck by, violence was in there. Transportation was really low on the non-fatal injury. How much do things cost? You kind of saw that. It's like $58 billion a year. So in the U.S., over $1 million or over $1 billion a week. That's what Liberty Mutual told us. What's the difference? I'm going to let you go ahead and answer that. But what's the difference? There's classifications. But I think what I try to explain to you in this lecture is that I want them all. Any chance to get insight into something that almost happened or had very, no harm or very low harm that usually you would just, dust yourself off and go back to work. I need to hear about those. We need to correct that. I want the workers to be successful in what they do or as effective as possible with as little risk as possible. And hopefully they elicit some satisfaction from the work they do, from their accomplishments. If I can get those three things balanced and doing well, I think the workers will be more successful. I think the company will be more successful. And I think they'll be more profitable. Everybody wins. But it's because I'm taking this more of a balanced or practical approach. How should a company respond to an accident? It talks about it in the chapters, but how should we respond? Without blame, with caring, with wanting to learn. That's really what it comes down to. That's everything for lecture 2. So let me know if you have any questions and make sure you answer the questions for the weekly homework.